Okay, now real quickly, let's do, okay, we've been through the respiratory system, let's do it one more time, okay? Now if we look, okay, muscles of respiration, okay? The external intercostals are lateral, and they elevate the ribs. They increase the horizontal dimension of the thorax, right? That's what increases or helps to increase the interpleural volume, okay? The internal intercostals are medial. They depress the ribs, so they are going to do what? Decrease interpleural pressure, okay? All right. Now, down here then, if you look, this is the rectus abdominis. This guy that's out here with the fibers that point down, these are the external obliques. The next two, this is the internal oblique, this guy here. The guy that's underneath there and there are the transverses. Those are two muscles of expiration. And then of course up here, okay, on top of the liver you have the diaphragm, which increases the vertical dimension of the thorax. It increases the interpleural volume, thereby decreasing the pressure. It's held in place by the falciform ligament that's here attached to the liver. Okay, we started up here, we talked about what? The thyroid cartilage, the cricoid cartilage, the trachea, the carina, where the trachea branches into the pulmonary, to the primary bronchi, and then the secondary bronchi. Okay. Underneath that, this structure's the esophagus that comes through there. What's the layer that's on the lungs? Visceral pleura. What's this that's out here? Parietal pleura. We talked about the lungs, and in this case the left lung, where you can see what? The oblique fissure that divides the superior and inferior lobes. Okay. Down here then we talked, okay. Remember when we talked about, okay, this organ's the liver, okay, the other stomach. All right. So this is the right lobe, this is the left lobe. You cannot see, or back up under here, the caudate and quadrate, but I'm primarily interested in these. Remember, there's 4 lobes of the liver. The gallbladder is this structure that's under here, and coming out of the gallbladder is the cystic duct. Okay, this structure that here is the stomach. Okay, over here, and you have to look under here, the absolute upper left-hand quadrant is the spleen. Okay, that's there. Of course, all of this is the small intestine. Now remember that once again, what's the if I put a pin in the intestine, what's the first layer it goes through?
Visceral peritoneum.
Visceral peritoneum. What's this out here? Parietal peritoneum. Okay. Now you can't distinguish between the jejunum and the ileum, the duodenum, jejunum, and ileum, right? Unless it's by where it is in location, right? If I pin it next to the stomach, then it's the duodenum. If I put it next to the large intestine, it's the ileum. Okay, and do that. Okay. We talked about the valves in and out of the stomach, small intestine, and that. In here, let me see where I'm at here. Okay. This guy here is the...
Did you say he doesn't have an appendix?
He does not have an
Is it
appendix.
because it was removed, or some
I
people just
think
don't
it
have
was.
one?
I think it was removed.
Oh.
I think he had an appendectomy.
Do some people just not have one?
Yeah, could be, or a very small one. Okay, this is the colon that's in here. Okay, that we cut. Okay, and doing that. You can tell as you get down here, this is the cecum, okay? You can see right here where the ileum comes in, okay? The large intestine is named because it's large, okay? And doing that. Now under here, okay, if you, okay, what membrane is this?
Mesentery?
What membrane? Well, what organ's this that's back here?
Spleen.
Kidney. What's this? Parietal peritoneum, because the kidneys are retroperitoneally located. They're behind that. And if you look at this guy and it's on the other side, there's the ureter that comes down out of it, so you have the kidney in there. If you look over here, you can also see, okay, you can see the kidney. On this one, you can see the renal artery, renal vein, ureter, and all of that that comes down with that, okay? Urinary bladder is down here behind the pubic bone, but it's pretty much collapsed. It's down under there. Okay? Any questions on any of that? So on next week, I'm going to have, I don't know, I haven't made the practical yet. There'll be 25 or 30 or 35 pins in here where we're doing what? Structure and function. What is it and what does it do? Okay? All right, so if you want to look, it's there. Okay, models are over there. Wet spirometers